Fractures and dislocations. A fracture is the breaking or bending of a bone which always has an associated damage to the soft tissue around the broken bone. The most common sites for bone fractures include the wrist, ankle and hip. Falls, sporting and motor vehicle accidents account for the majority of broken bones. If the ambulance is on the way, the casualty should be asked not to move the injured limb. If the ambulance will be a while, do not move the casualty unless there is immediate danger. Control any bleeding and cover any wounds. If a bone is protruding, apply pressure around the edges of the wound. A dislocation is where a bone gets dislodged from a joint, which then usually cannot move. The casualty will feel severe pain and deformity of the joint area, tenderness and ability to move limb without pain. Like fractures, dislocations are considered urgent situations that require medical care. However, a dislocation can be treated until the casualty can receive professional medical help. Head injuries. Head injuries may cause loss of consciousness, bleeding, neck or spinal injury, damage to the brain, eyes, ears, teeth, airways and mouth, or other structures. Head injuries should be suspected when trips and falls from heights occur, blunt trauma, high impact injuries, or more. Concussion is a temporary loss or altered state of consciousness after a head injury. You should seek urgent medical assistance if the casualty shows a subsequent decline in the level of consciousness. Handle extremely gentle and maintain spinal alignment at all times. Complete a thorough assessment of the casualty, including the spine, eyes and ears. Motor vehicle accidents. A person may survive the initial impact of a motor vehicle accident, but other associated elements may cause death, such as airway obstruction whilst unconscious or severe bleeding. Make the scene safe. Identify and assess dangers. Remove or minimise hazards. You may need to evacuate the casualties to a safer place. For multiple cars and casualties, count the number of people injured and conduct a basic triage. Check responses. Look for unconsciousness and those who are not breathing and treat first. Look for bleeding and other injuries. Call an ambulance. Needle stick injuries. A needle stick injury occurs when the skin is accidentally punctured by the use of a used needle. If a needle stick injury occurs, seek medical advice. If you're at work, notify your supervisor or WHS officer. In many cases, treatment of the needle mark and counselling is all that is needed. Soft tissue injuries, sprains and strains. Soft tissue injuries may be sudden or get worse gradually. Further treatment depends on the type and the severity of the injury. Always see your doctor if pain persists after a couple of days. A sprain, joint injury, tearing of the ligament and joint capsule, common sites, thumb, ankle and wrist. A strain, injury to muscles or tendons, common sites, the calf, groin and hamstring. You should use the acronym RICE: rest, ice, compression and elevation. Spinal injuries. The spinal cord is a mass of nerve fibres that enable signals to travel between the brain and the rest of the body. It runs down through the neck and is protected by the spinal column. Fractures, whiplash or poor posture and degenerative diseases such as arthritis are the most common causes of neck pain or injury. Whiplash injury is an injury to the neck that results from a sudden jerking backwards and forwards. First aid for these would include ensuring that you handle the casualty extremely carefully and use spinal alignment at all times to try and prevent further or permanent damage. You should call an ambulance as soon as possible. If conscious, keep the casualty still and maintain support of their neck until help arrives. Thank you for watching this video on trauma. Please remember that there is further information relating to this topic available on our website at the corresponding PDF document.